The following video will show you how to prepare and inject 600 units of subcutaneous Menopur Multidose at home. Menopur is prescribed to stimulate the ovaries to produce follicles containing the oocytes. Before you begin, check against your KKIVF Center injection form to ensure that subcutaneous Menopur is ordered for the day. Do administer the medication at the same time each day. Then, practice proper hand hygiene by washing your hands with soap or use a hand sanitizer. Next, prepare the following items: 1 600 unit valve of Menopur Multidose. Inspect the medication. Ensure the medication is clear with no particles and that it is not expired. 1 pre-filled syringe containing the solvent. 1 needle for mixing. 1 injection syringe with the needle attached. 2 pieces of alcohol swab. 1 container for disposing the injection, such as a disposable plastic bottle. Step 1. Mix the 600 unit valve of Menopur Multidose with the pre-filled solvent. Remove the cap of the 600 unit valve of Menopur Multidose and clean the top with an alcohol swab. Remove the rubber cap from the pre-filled solvent and push the needle firmly to attach them. Remove the cap from the needle and inject the solvent into the valve. Remove the needle and the syringe. Throw them into the disposable container. Gently swirl the solution to mix. The solution should be clear in color with no particles. Ready to be used and can be kept for 28 days at room temperature. Do not freeze the medication. Step 2. Draw the prescribed dose. And clean the top with an alcohol swab. Open the injection syringe from the packaging. Push the plunger to the end and remove the needle cap. Insert the injection syringe into the valve and invert them. Draw the prescribed dose by pulling the plunger. Ensure that there are no air bubbles in the syringe. If air bubbles are present, hold the syringe upright and push the plunger slowly to expel them. Remove the injection syringe from the valve with the prescribed dose. Step 3. Inspect the injection site. Inspect your skin to make sure there's no bruising, swelling, hardness, or irritation in the area of the injection. Step 4. Clean the injection site. Clean the selected site with an alcohol swab and let it dry thoroughly before the injection. Step 5. Administer the injection. The injection can be given anywhere 2 fingers below the navel. Use a different injection site each time to lessen the chance of damage to the tissues under the skin. Firmly pinch the skin with your thumb and index finger and hold it. Hold the syringe with your dominant hand and ensure that your thumb can reach the plunger. Inject the needle into the pinched skin at a 90-degree angle. Then, release the skin when the needle is fully inserted and slowly push the plunger to inject all the medication. Hold for 5 seconds. Step 6. Withdraw the injection and discard it into the disposable container. Use an alcohol swab to apply light pressure and gently wipe the injected site. After reconstitution, the solution may be stored for a maximum of 28 days at not more than 25 degrees Celsius. Do not freeze it. Thank you for watching this video. We hope that it has been informative.